all, my name is Danielle Murray, and I've created a program that will hopefully tackle the ongoing opioid epidemic the state of Kentucky has been facing over the last decade. And yes, I said decade. Kentucky is one of the top 5 states that has been suffering from this opioid epidemic. They've severely been impacted by the epidemic due to the restriction and availability of prescription painkillers. In July of 2012, Kentucky began requiring both doctors and pharmacies to register with the state's prescription drug monitoring program, called Kentucky All Schedule Electronic Reporting System, or better known as CASPR. Doctors are to review a patient's CASPR report before prescribing them any kind of controlled substance, and again before granting the refill. A refill cannot be granted until the patient has went through the CASPR system again. Also, pharmacies must report each prescription filled and they have for a controlled substance. The pharmacy has 24 hours to do so. If not reported within 24 hours, they'll be penalized. This helps doctors spot patients who may be what they call doctor shopping, or just looking for a doctor who will prescribe anyone and everyone a controlled substance with no care in the world as to what may happen or if that person may become addicted. And although Kentucky's opioid epidemic is severe statewide, northern Kentucky has been hit the hardest by this issue. Over 140 people died in 2014 and 2015 from an overdose due to opioids. Louisville, with twice the population, only reported 111 such deaths within the same time period. And Lexington reported only 81 heroin overdose deaths within the same time period. Opioid abuse and overdose are some of the most significant health concerns facing the state of Kentucky, and it directly contributes to a number of other problems the state's facing, such as the number of children entering foster care due to their parents suffering an opioid addiction. The heroin epidemic is damaging to families, and it continues to leave children in insecure conditions. One of the goals is to reunite children with their parents and to make sure that's where they stay. I truly believe children need to be in their parents' household. Jumping around from foster care house to foster care house doesn't make a child feel that they're wanted. I think a child being in their own household and being with their own family can help a child succeed and be more successful, and let them know that they actually are wanted once the family and the parents become clean for their children. Also, these children are often victims of neglect, abuse, psychological problems, and with these other issues, that plays a part in foster care. That means that they could jump from family to family because one family may not be able to put up with the issues that the child is going through due to their parents' addiction. So again, this is where we would like to stop seeing that happen. The targeted area to reduce the opioid epidemic in Kentucky is in the northern part of the state. We're hoping that if the epidemic can be controlled in that area, that other parts of the state can mirror these results. This is a serious epidemic that needs more attention than I think it has been receiving over the last decade. This program will focus on pregnant women and parents who are suffering from the opioid addiction. Drug use by parents has significant psychological and developmental issues on their children, and that, as previously stated. The children suffering can go to school with many problems, behavioral issues, ADHD, emotional instability, and many learning difficulties. A focus on pregnant women and parents suffering from opioid addiction is needed because a child does not need to suffer at the expense of their parents. According to the Kentucky Nurse Journal, there has been an increase in the number of children being reported into foster care over the last few years due to the opioid epidemic going on. Almost 75% of children reported into foster care in the state of Kentucky are because of drug-addicted parents. 75% of children in foster care? 3/4? That's way too many because their parents have a drug addiction. The program has created guidelines in order for the parents to regain custody of their children. It's also been determined by the state of Kentucky that these requirements need to be met before gaining custody of their children back. Standards can include, but are not limited to, a negative drug test, maintaining full-time employment, viable housing, and required continued therapies. Kentucky's opioid program has been designed to offer individual and group counseling sessions for parents and pregnant women suffering from the addiction. We also have a detox facility. This program will help the individual get on the right track to gaining custody of their children back. Also, by helping pregnant women suffering from the addiction, the program would like to see a decline in the number of infants born addicted to opioids. Kentucky's opioid program has been designed to help parents struggling while detoxing in a safe facility staffed by a nurse at all times. In conclusion, KOP, also known as Kentucky's opioid program, will take a stance to stop this opioid epidemic in northern Kentucky, one person at a time. KOP has been designed to offer counseling sessions, whether that be in an individual or a group setting. Also, the program has been designed to offer a detox facility, as previously stated as well, for the parents to become clean for their children and keeping them out of foster care. KOP strives to be the best, most reliable detox center and counseling center Northern Kentucky has seen in a long time. Kentucky's opioid program will be the people's voice. We're here for them. We want to help. We need to help these people. In addition, we are also looking for strategies that will help prevent overdoses, period, and to stop this abuse. Thank you all for your time and consideration. I hope you want to help us in creating a better Kentucky for everyone. Thank you.